We have guests in the studio. We'll be talking health. Remember, Healthy Fridays. Our healthy conversation today is using developing affordable healthcare solutions through digital solutions. CT has the proverb.
Those who pry into other people's affairs will hear and see what they do not like.
Those who pry into other people's affairs will hear and see.
Actually, the proverb was will hear, but I've added the see because I figured, if you're going to hear it, you might as well see it.
Oh, okay.
What they don't like.
Yes. When you pry into other people's affairs, you expect something that will be to your liking. Rarely do human beings head towards things that will cause them discomfort or things they don't like.
Right.
Yes,
Unless
so-
it has been tried and tested that if you do this, you will find things that you don't like. And yet, human beings still go and look for these things.
So other people's affairs here, to modernize the conversation, could be other people's phones.
Actually, it could. Let's start with something even fundamental. Okay? This one is going to sound a little sexist. It isn't.
I'm ready.
It is a question that many men attribute to women. You are called at the auditorium to be asked, where are you?
Mm-hmm.
The question usually isn't where are you? The question is, who are you with? And men usually don't react or respond kindly to it. That's prying into other people's business.
Oh, okay.
Yes.
Why are you looking at me like that?
You're the only female here.
So,
I'm addressing you.
how do you know that I'm not asked? Anyway.
Our guests this morning are two doctors. One is Dr. Joseph Murad. He is the CEO of a company that I'm going to introduce shortly. And the other one is the Diagnostics and Performance Manager at the same company, Dr. Mandela Kibiriti. The company is BYON8. BYON8. Bring your own Ninhi. 8. Dr. Joseph, good morning.
Morning.
Welcome to Kenya's biggest conversation. It's good to have you on the show. Good to have you as well, Dr. Kibiriti.
Thank you so much.
Karibuni sana. So tell us about BYON8. What is it?
What is it? Good question. BYON8, I would say, is the most affordable and accessible healthcare solution out there. It's a launched and smartphone application that you can download on Android, iOS, and you can talk to doctors online. That's the simplest way of explaining it. And we're available 24/7 at your service, correct? Right, Mandela?
That's true. As early as 4 a.m.
Exactly.
as
As early as 4 a.m.
Whatever time of day.
Every time of day.
So how does it work then, Dr. Mandela? So you're saying that it's a service where I can call a doctor, or is it a service where I can write a doctor? Or
So it's basically, we have two service offerings.
Okay.
The first one is what we call a symptom checker, where you key in your symptoms and a medical engine, which is AI based, is the one that then gives you differential diagnosis as to what's causing those kinds of symptoms, and then also recommendations as to what to do next. And then the second service offering is the consultation service, and this is with general practitioners and specialists. So with the GPs that we have, it's either text-based, where you can actually just send text to the doctor, or video consultations as well. And for the specialists, it's just purely video consultations.
so nothing physical?
And nothing physical.
At no point am I required to go and go for triage and blah, blah, blah before I see a doctor?
Well, the symptom checker does act like a digital triage mechanism, where before you even start the consultation, by keying your symptoms with the symptom checker, we already have like a sense of what's going on with you. So the teleconsultation service is what's the next level to actually confirm the diagnosis, and really the recommendations that you need to stay healthy at the end of the day.
Okay. Walk us through this process, this AI process that is able to take all these myriad of symptoms from this large diversity of people and be able to come up with something that will approximate what your problem is likely to be. I just want you to walk us through so that those who are listening understand how this system actually works.
Okay.
So say I start with something. What are you feeling?
In the morning when I woke up, I was feeling that my nose wasn't my own. Then An hour later, it was my head.
No, so let's talk about the time when you're going onto the AI. What are you typing? What's the first thing that you say?
What I'm saying is what I'm typing.
I woke up in the morning.
Yes.
I didn't have my nose.
Yes. No, it was there, but it didn't feel like my own. It's not the nose I went to sleep with. And then, when we got to around 6 o'clock, all those symptoms moved to my stomach. And now, I felt like there was a stone in my stomach. What could I possibly have?
The AI will tell you to go to hospital. So basically, what you'd key in. So obviously, the app is free to download. It's on Play Store and App Store. So that's where you'd start. And then when you sign in into the application, the symptom checker asks the key symptoms that you've had or you're presenting with at that specific time. And then beyond that, the symptom checker will then interrogate the symptoms in detail. So when did it start? Are the symptoms worsening? Are there any associated factors to it? Are there things that help the symptoms get better? And also related to that is your biodata from your age, your gender as well, because that also plays a role in the final recommendation as well.
You know what you say makes sense to me, but let me perhaps leave the facetiousness of the conversation and get something real. There are very many conditions that people present with and are taken to hospital, but they could be a myriad of things. The fact that you have a fever doesn't mean you have malaria. Yet, for us here, when someone says I have malaria, they mean they have a fever. Okay? By the same token, I may have a nosebleed and I think there's something wrong with some blood vessel, but it could be symptomatic of something else.
That's true.
Now, if what you're saying the app does it well, then it could prevent a lot of harm that people come to by simply ignoring certain symptoms and not seeking appropriate help at a certain time. So what I was asking, I think you've got where I'm going with this. I'm asking, I like the idea, but I want to understand how broad a base this particular AI has so that I can determine with a certainty or a high degree of certainty that whatever it's going to do will provide what is humanly best possible for someone to actually go by in terms of diagnostics. That's really what I'm asking.
And I do think, I mean, something that we can talk about is, as you're saying, like how did we build this thing and how did it get to this point? Because currently we're covering hundreds of different diagnoses and diseases, and it can detect from a wide variety of different cases, like, for example, malaria and others as well. And the reason to why it can be accurate is, I would say, the way we have developed it. We've developed it for nearly 4 years, the actual engine, testing it at working with universities, working with doctors in also determining how accurate it is. So we've actually been using, you could say, real-life patient cases in comparison to how doctors actually diagnose them, and in the end compile this into this symptom checker without getting too technical. Yeah, and it's all about studying these diseases over a long time and trying to get that into one application, because what do you have as I would say the substitute of the symptom checker would be Google, right? You go in, you input that you have a fever, and you get 100 different suggestions. You might even have cancer or something, and that's what we're trying to avoid, right? Yeah. Not to panic. Give you a list of diseases to look at.
Why go this way? What I mean, we're looking at solutions. That means that there was a problem, right? We're looking to fill up something. There was a gap somewhere. Yeah. Why choose to use this method to deliver healthcare in the country? What was the factor that said, all right, this has to be the way we go? Why?
Yeah, I mean, I think if we're looking at the problem, at least in healthcare, and I think not only in Kenya, there are two things. You have the accessibility of healthcare and the affordability. And I do think in regards to accessibility, we already know that we don't have enough doctors to meet the demands of the patients out there. Unfortunately, like that's how it is. And apart from the accessibility standpoint, what you have as an alternative is, for example, go to the private sector, and all of a sudden affordability becomes a problem, right? That consultations maybe are too expensive. And that's really where, digital healthcare comes in. Because if you can access healthcare for free through the symptom checker, at least you have an idea of what you need to do, right? Because it doesn't only tell you the disease it might be, but it also tells you, should you stay at home? Should you seek healthcare? And that's where our doctors that are available online also comes in, right? So you can continue on that journey, talk to a doctor, even get a prescription, and then move on from that as well.
So what is this thing? Is it a website? Is it an app? Is it an SMS-based service? What is BYON8?
It's an application.
Yeah.
So basically, it's a mobile app, which is, as I mentioned, downloadable on Play Store and App Store for Android and iOS phones. And basically, just to touch on also what Joseph mentioned, we are trying to create this filter, and more importantly, this base for primary care. A lot of the time, I've seen it also in my profession, is when a patient walks in, the first thing they ask is, I want to see a specialist. The question is, okay, why? The key thing that we are trying to do right now is, one, make patients empowered to understand what they might have. And an empowered patient is an informed patient. So that's where the symptom checker comes in. That's where the consultation service comes in. And the second thing is, once they're informed, and they can have access to a doctor readily through the application, because we have a crazy high phone penetration rate, a mobile phone penetration rate in the country. Thankfully, our internet coverage is also good. You are creating this element where the primary base for primary care can be established through digital health services like BYON8, so that when you download the app, and you have access to the doctors, and you do have access to the consultation services. And something else we are trying to do is build this referral network where you have access also to labs, facilities, and pharmacies. You're literally handheld through your entire journey as a patient. And that's what we want to do at the end of the day, where we don't want patients falling through the cracks because of misdiagnoses, because they haven't gotten care as soon as they should have. And that's really the essence and the mission and vision that we have at BYON8.
But then why would patients then need you as doctors? Because already we have a problem with self-medication, where people decide, this is what I have, this is what I need. Now, if you've taken the point where they can be quasi-medical professionals, they will self-diagnose and head straight to the pharmacy and say, this AI fact checker has told me I am pregnant. So now, I mean...
Just to clarify, the symptom checker doesn't give you prescriptions.
It doesn't need to. I will
just
go,
need to know
I
what
will
medicine
go with
am I
the
going to buy?
possibilities, and I'll go to the pharmacies and tell them, this is what the fact checker has told me. So what do you have, ranging from cough syrup to things which sort out problems in the stomach? And then you ask him, which one's the best one? And he'll choose the most expensive and say, this one, we know, broad-based, does everything. In fact, even things which you imagine it can sort out. Where does your relevance come in when you've given people this avenue?
Rightfully so. So
to
if
play doctor.
So if you look at the symptom check, actually the recommendation levels include the consultation service as well. So there are recommendations from the symptom checker that actually insist that you talk to a doctor, which is now the consultation service that we offer at the end of the day. So it's this first capture the patients and get that population, especially the ones that do need to see a doctor, because that's lacking in our country as well. Move them to the consultation service, empower them with the referral network that we have, and then carry them through that entire journey to ensure that they live healthier lives. And that's really the essence of this whole digital platform that we've built and built.
Okay, Dr. Mandela. So you've identified the problem is that we don't have many people going to seek health services, right?
Yeah.
Why is that a problem? I mean, why is it so?
Well, it goes back to the accessibility and affordability question as well. If you look at our country, a vast majority of them work in informal sector. Also, a vast majority of them don't have health insurance. So that is improving with the mandatory law
NHIF.
that NHIF, you have to be a contributor to it. But then again, also it's a question of, well, I am under NHIF. I do probably have some level of care wherever I am, but how far is it? You know, if you look at the ratio to the doctors and the population that we serve, the demand is definitely there. So then using the existing resources, which is the mobile phone penetration rate and the internet coverage, can we then at least get the doctors to where the patients are as quickly as possible and as far as possible as well?
But then there's something that you haven't. I now see the problem. The issue that CT is raising currently, with all those challenges, people have found a way out. And the way out is self-diagnosis, is using
Self-medication.
history, just looking at when so-and-so had a headache, this is what they took and they felt better. When so-and-so was having a running stomach, this is what they took and they got better. So we get into that community self-diagnosis. How do you address that? How do you get over that challenge? Because now you're basically introducing a new, more believable member of the community who's telling me that, yes, you have a running stomach. The likelihood is that you have amoeba, you have, this
H.
new
pylori.
H. pylori, which now everybody has H. pylori. So the possibility is H. pylori because, and then I'm like, but Ndu had H. pylori the other day. Dr. Mandela had H. pylori, so likely H. pylori. Let me go seek medication for H. pylori. How do you address that so that then you actually are not perpetrating and perpetuating this problem?
Yeah.
Maybe we can start with one simple thing that I think we all have in common in regards to healthcare, and that is trust. Whenever you see a clinician, whoever you're approaching, one of the main reasons to why you're going back to them is the trust factor. You do want to talk to somebody who you trust in the end, and the advice that you're giving them. So if you look at what we are doing with the symptom checker, is number one, we give people an informed way of making a decision, first of all. So even if you do self-medicate, I would rather have somebody self-medicate that is informed and uses a method that is, way more accurate than Google, let's say. Then let's say but because this is the issue, right? You Google diseases and then maybe you go for the top suggestions and that's what you go for. But at the same time, as the user is using the symptom checker, we're also educating them. We're letting them know when the recommendations come up, do not self-medicate. This is, for example, we even have warning signs around specific medications. So as they're trusting this application more and more, hopefully we can also move away from the behavior of immediately going to a pharmacy and just, going with the first advice, because we never give the user one diagnose or one disease. It's a choice between 5 or 6 or 7, and then the user must choose, okay, which one of these should I go for? And I think we're creating this behavior of it's being a risky behavior, like choosing between 7 diseases is that's a risk of chance.
And just to add, again, going back, recommendations based on the symptom checker, consultation services are then recommended. That's where we're capturing the patients. That's where we're actually saying you have these differential diagnoses, recommendation, talk to a doctor.
I'm going to come back to the cost of these consultations. But what I see as a major challenge is you are competing with existing cultures that people have when it comes to healthcare seeking behavior. You see, what Eric mentioned about the way the community handles diseases, it's something that those who are in the care and treatment work of HIV were constantly grappling with. You get someone whose adherence levels are good, so they're given medication for, say, 2 months. If somebody comes to them and says they have this problem and the other, they say, even I had that problem. In fact,
this is what I did.
Don't worry. That one, not a problem. Why don't you take this? You'll find big difference.
In fact, I can give you some of mine.
No, they give you because they have 2 months supply. They do not see how it is going to interfere. And then they realize when time for the second visit comes or the visit comes in, they realize they don't have the drugs. So they're not adhering now. So they're going to go back to the clinic or the hospital with problems. They will not honestly tell you what it is that they did. But what they also don't know, they've introduced ARVs to people who shouldn't or may not even need ARVs. And they are creating yet another secondary problem that will become a big problem later. But all in the name of good. Treatment, especially when somebody has the availability at a communal level, they will treat it as something that they ought to participate in. So how do you get people to change this way of thinking and to understand that that same thinking can be applied to this app that you have?
Let me actually, that's a really important point that you've raised. The reason why somebody would then accept the medication that, oh, it worked for me, then it should work for you, is one, do they have the necessary information to actually make that kind of decision? That's where you should begin, because then if I'm not well informed as to whether this medication will actually help me, whether it will actually have an impact on my health, then was it Loliondo?
Babu Loliondo.
Yeah, it's the same thing, where if we were informed, or if people were informed that this thing actually doesn't, really work, or does work, for example, if it really did, then people would be making the right decisions. So and this is why patient education is so important, and empowering the patients to actually make the right decisions, because it's from that point that the user journey to actually seek healthcare starts. If I am more informed, if I'm more empowered, if I can access this thing on my phone, where before then I'd have to walk kilometers to just get even advice, where I can actually speak to a doctor and then they can give me the recommendations as to what to do next, where you actually have your patient history and data on the app so that you can follow your journey as well as a patient. You are well empowered to actually seek care, and then you have, an upper hand, and you actually own your care at the end of the day as a patient. And that's really what we're trying to do here. That start with make patients first informed as to what they should do, give them the right tools and accessibility to the doctors that then can give them the actual advice that they need, create this referral network where if they do need the care physically, they can easily access that. And it's all empowered and scalable through digital health solutions.
I'm saying something different, slightly. What you're saying, I understand fully. But I am talking about the sense of community and the way people like to handle things within the community. You are referring to the individual, which is good. And the individual may get what you're saying. But if what you've told them and what they now know because of you is contrary to what is accepted in the community, you already have a hindrance to that person actually benefiting from this. So I am saying this. Is there an understanding that perhaps you need to consider looking at individuals as you do, but looking at community or groupings of people so that this same information is actually shared from the very, very onset, not with the individual. So it's not one person who has the information.
Everybody does.
Many people have the information. So even discussions around it involves a group. The acceptability factor will play a big role in how they use that particular app or how they use that particular information.
Let's take a break at this point and then we continue the conversation. Our guests this morning are talking about how best we can develop affordable healthcare through digital solutions. So can you actually get to that point where we get primary healthcare services just diagnosing via an app where you are talking to an AI that has been fed with medical information that then you're telling it, these are my symptoms. It can tell you, this is likely what you have. And then it advises you what to do next. Maybe go seek medical advice, go see a doctor, or we have a doctor on call. Let this doctor call you, or you need to rush to a hospital immediately. That conversation continues with Dr. Mandela Kibiriti, Diagnostics and Performance Manager at BYON8, and Dr. Joseph Murad, who is the CEO of this organization.
Spice.
Kenya's biggest conversation continues with Eric Latif, Nduoko CT Muga, and our guests this morning, Dr. Joseph Murad, CEO of BYON8, and Dr. Mandela Kibiriti, Diagnostics and Performance Manager at the same organization. We are talking about this particular platform that they've come up with, which is an AI-based digital health platform for patients and also healthcare providers. How is it that you use it to get diagnostics, to also get some consultation from healthcare providers? Now, one of the things that you'll agree with me is that in this country, and I think indeed in the world, the field of medicine is highly regulated, and for good reason. So in the country, you don't practice as a doctor if you haven't been licensed by the Kenya Medical Practitioners and Dentists Board or Council. You don't become a nurse unless you have the Nursing Council license. You don't start a hospital unless the board has come and inspected and said, we give you the license to run us. So this particular platform, because it's offering the services similar to what a clinic would do, Is it regulated? Is it licensed?
Yes, it is. So we are licensed by the Kenya Medical Dentists Council. And all our doctors are actually licensed by the same council as well, myself included.
Hopefully, right?
Yeah. So we are following those kinds of procedures, and beyond that also is patient data security. We're actually following GDPR laws, and this is because we want to ensure that whatever information that you share with our doctors in the consultation services, it's safe and secure. Just to give you an idea, is all information is anonymized and pseudonymized, where if you're having the consultation with the doctor, only you, the person who's seeking that consultation as a patient, has access to that information, and the doctor providing the consultation. So all that data is safe and secure because we do follow those standards as well.
And you're in control, right? Because you can delete your data anytime you want as well. And that's the beauty of it. Or you keep it, you share it with whoever you want to share it with. I mean, I think we can all relate going to different doctors, forgetting about our history as well, and like having all that in one place. That's a value by itself.
Sure.
But Dr. Joseph, there are those who argue that anything that enters the realms of IT is never really lost. It's never really deleted. But anyway, do you want to ask something?
Sure. So, I mean, even as we look at these solutions, what help then have we accorded patients who would essentially say, I'm going to get onto this app because this has been here for some time. I'm going to get onto this app. I'm feeling a certain type of way. I get my symptoms. Onto what is the process like? I get on the app and then I go about, I get consultation services, but I must still leave where I am and go get medicine or get a test. So it's not are we saying it's a complete solution that where I am sitting, I do not need to leave where I am sitting, save for going to get any kind of medication that I might need? Or do I still have to add the element of travel to seeking this healthcare?
I would say that's exactly what it is. It is the convenience factor it brings, because you can think of it as a one-stop solution for all your outpatient needs. When you go into the app, you either choose, right? You can do the symptom checker or you can talk to a doctor online. And what we provide beyond the online consultation is, for example, home delivery of medication. So if you get a prescription, you can get that home delivered. If you need to do lab tests and you need to continue the medical investigation, we even do home collection of lab tests. So yes, we can actually remove a lot of that, let's say the logistical issues of getting back and forth and going, waiting in queue, all of that. That's also what we're trying to provide beyond, the actual online consultation itself.
Sure.
Yeah.
And even as we talk about mobile telephony and internet penetration in the country being extremely high, we also have to ask the question, then what are people using these two things for? And is there a high encouragement for people to go online then and seek healthcare? You see what I'm saying? So what are people using phones for? Maybe to transfer money really quickly here and there. Are people getting on the internet to seek medical care? Those who are maybe in a secluded part of the population. So how are we getting this out to somebody who is in rural Kenya? Or is it the privilege of just those who may be on their device the whole day and say, well, all right, I have a headache and let me see how I can, figure this out? Is it for everybody?
So one thing, and I guess it goes back to the community question as well, in how to ensure that there's an acceptance for these kinds of solutions, is one, this is why we're very big on partnerships, not beyond just, the referral network, but also the people who are within those communities. This is why, it's a constant effort from our side to involve as many people from a county level as well, to the facilities on the ground, so that when patients do come in, and this is what we've been actually talking about, care points, where you don't have to have the smartphone itself, but there are care points where you can access a tablet of some sort, because it is a digital app. The tablet then can offer that kind of service to the patients by just getting to that care point. This is only enabled with players, in the sector, and this is why collaboration is so key. And then going back to the thing about the community, I mean, we've had over 250,000 downloads, 250,000 downloads since we started. The application has 20 to 30,000 active users month on month. It just goes to show that there are people who actually trust this service, and we do take this trust very, we take it to heart, because we really want to ensure that every patient that does come through the application, either at these specific care points or through the application with their individual phones, that they get this end-to-end experience catered for. And this is what we're really keen on doing at the end of the
When you say you have partners, what sort of partners do you have?
So, for example, medication, as they're getting the prescriptions at home. So we have Kasha and MyDAO who has a delivery option as well. And SysPharma, who we are trying to come and develop these care points within their physical pharmacies as well. To facilities like Halcyon, Imperial Medical, which is a chain of facilities as well. Poplar Hospital, Maristops, so we are trying to get as many facilities to work with, so that whenever you do need the diagnostics, whenever you do need the medication, when you're on the application, you have access to those individuals as well.
So taking that step back again, you are seeking to address a problem, right? And one of those problems is that people do not go to seek healthcare services, number one, and people have various reasons why they feel that there are very many barriers to seeking healthcare. One of those barriers is cost. The other is access, either distance or time or just availability of a good facility. So those are the solutions you're trying to solve. Tell me about the costs, because this is a big issue in healthcare. At some point, I'm sure, and I'm using this app, and I've been go through diagnostics. It'll tell me talk to a doctor. Obviously, the doctor is going to be a cost at some point.
True.
So how are you addressing that?
Okay. Let's look at, when was the last time you were at hospital? For the nose and the stomach.
No, the nose and stomach was this morning.
Oh, this morning.
He hasn't gone to hospital
I'm
yet.
gone for that.
So you should go on the app.
Why do you think I'm so knowledgeable about self-medication?
Good. So let's say on average, just looking at the price points for a general practitioner consultation, especially in private facilities, it ranges between 1,000 to 2,000 shillings, depending on where you're going. On our case, it's 395 shillings to text a doctor on the app. Massive difference.
Okay. To text a doctor and receive a response?
Yes,
Okay.
in real time.
To have a
To
conversation.
have a conversation.
Once.
So consultation is 375 shillings.
395.
And that's a 24-hour
Hour
consultation.
consultation.
So you
Okay.
can text and chat with the doctor for up to 24 hours.
24 hours.
Yeah.
So you can have the consultation, go do your lab tests, we get the results, we give you the recommendations. Within 24 hours, it's 395 shillings. And that was with the added, we are working with the referral network. So by giving you that recommendation that you do need a lab test, our referral partners are aware. They can do the home collections. If it's drugs, they can send you the medication that deliver it to you. So that's the first thing. If it's video based, it's 695 shillings. Okay. So the text and the video in this case, where it's 395 and 695, it's randomized, where you can actually.
There's 95. You're going to explain it, but anyway, go on.
So let's just make it easier. So it's 400 shillings.
Thank you.
Kuna tax. There's tax and then there's a 5 bob discount.
So just by accessing a doctor either via text and video, it's already cheaper than the consultation service that you'd get in any private facility.
When the council licensed you to operate, what conditions were you given? Because I'm thinking about this. So I've gone through this app right now. I told it I have a swelling on my right leg. It kept asking me questions. Swelling, right leg. At what point does the swelling get worse? Morning, and when I wake up, evening when I'm going to sleep. I told you I don't know. Various things. It gave me several number of options of what could be the problem. Among them is preeclampsia.
Did you tell them about? Did you tell them about?
It has
Who
me.
you
Are
are?
you a man? Yes. What you
Yeah,
ate?
but
Anyway.
Yes.
Then there's the option there. Talk to a doctor.
Yeah.
So if I spoke to a doctor, and let's even say that I chose the video option, we talk to a doctor, and the doctor sends me go to a lab and get these kind of tests, and then give me the results. the doctor is basically just going to look at those results, look at what I've been saying, and move on to the next stage.
So
And this is okay by government.
So let's start first and foremost. We train our doctors as to how to offer the digital consultations first and foremost, because you're entering a new form of medical provision. That's the first thing. So first and foremost, all the doctors that are on the platform are vetted. First and foremost, to see where they were trained. Are they actually licensed by the council? Secondly, we then take them through a process where they have to abide to specific standards as to how to offer those teleconsultation services. Because the key thing, again, primary care, is to identify, and this is more of like a filter, identify those that do need to go seek physical care. And this actually was more apparent during COVID times. Identify those that do need to seek physical care, and for those that do not, find a way to ensure that they actually get the quality of care that they deserve. That's the first thing. So the only reason why we were actually given this approval by the council is that we are working with doctors who are licensed to provide these kinds of care. And we also take it upon ourselves to ensure that these doctors are trained as to how to provide these consultation services. And within the medical department that I work with, and together with the chief medical officer, we review every single consultation to ensure that the right recommendation was given. So the filters to ensure that the patient actually gets the care that they need starts from the symptom checker to the ensuring that the doctors are actually providing the care that they need. So the quality control that we are currently doing on a constant basis, so that at the end of the day, the patient actually gets the care that they deserve.
Does the council give you some certain conditions and say, okay, we are trying this out, we all don't know this thing that we're going to do. Yes, we want to encourage moving into offering digital solutions for healthcare. But then, one doctor shall not talk to this patient for like 3-4 times without saying, come, I see you personally, you go get seen by a physician. Are there such conditions? I'm just thinking, I mean, you walk to a hospital, you'll find a doctor with a stethoscope all the time. There must be a reason. And here you are telling me that this stethoscope does not have to be used at all.
No. We're not saying that.
Stethoscope is a very nice look.
No, what we are saying is those that do need physical care are channeled through the right places to actually get that physical care.
Okay.
Those that do not then can get the care within the application.
So are we saying then that there is a high prevalence of folks who are going to hospital and then don't necessarily need to do so?
Yes.
That's the simple way of
Yeah,
answering it. Like you can diagnose a lot of the conditions online, and of course some of them you can't, and then you need to refer. And also think of it like this: by using a service like this, your consultation is not only reviewed by one doctor but several doctors to ensure that you actually get the right diagnosis. So that's even an added value to the patient as well in regards to the quality.
In terms of turnaround time, what are we looking at as well? That you get onto the app and then you're able to then start to speak to a doctor. Are you sitting around the whole day waiting for doctors to get back to you, or how long is it? I'm feeling this kind of way now. I get onto the app and I'm hoping to speak to somebody so that I can get relief for whatever I'm feeling. How long are we looking at?
5 to 10 minutes.
Yeah.
That's roughly the waiting time we have. And then, of course, if you do want to, you can also choose to book, let's say, a specific time slot with a doctor, but then that's up to you, right? When you want to.
And okay. And then in terms of variety of illnesses that we are looking at, I mean, when you think that you're going to get on the phone and speak to a doctor, the perception might be that it would be your simple, mild symptoms that are being dealt with. But then in terms of severity of illness, are we looking across board from something as, like the common cold all the way, up the charts onto whatever else it may be?
Yeah. So that's why we have the general practitioners and the specialists on the app. So for the specialists, if I can speak a little bit about that. So we have from internal medicine to a general surgeon, to an obstetrician and gynecologist, to pediatricians, a psychiatrist. We also have a team of psychologists as well. So there's a plethora of services that we can actually offer to patients on the application. Yeah.
The issue again of cost. So is there a conversation that your platform is having with various insurance providers? So say I'm insured, this $795, $695, whatever will be taken care of by insurance.
Yes.
That's exactly the case, and that's what we're trying to cater for is onboard insurance providers onto the platform. So you simply register your details and you can access these consultations for free from your sense if you have an insurance premium plan, right? And also, we do want to say NHIF, if you're looking, we're here.
The partnerships you mentioned, I like the partnerships, but I'm going back to something that I'm familiar with. Do you have any partnerships with existing non-governmental organizations, CBOs, that work in the health sphere? Because these are people who already have contacts with communities, and they also work with existing medical government agencies. So they are, in my mind, a one-stop shop for many things. Do you have, or are you thinking of partnerships with such people? Because you find them right around the country.
We're in conversations actually with a couple, but we want to first finalize those kinds of conversations before we actually make any comment on them, because we totally agree on the fact that we do need to get to the communities, actually at the heart of the community, because that's where the change is. So we're in conversations with some. If I need to name drop.
No. You don't need to name drop. I mean, if you're having the name dropping may actually jeopardize whatever it is you're saying. But if you have them, you see, if you're talking about penetrating and looking at larger numbers who can actually access this information, which for many would be new, it is better when they're dealing with people they already know and accept and trust. See? Yes.
Isn't this where the world is going, though? I mean, because you can read a book on your phone now. You can do your banking on the phone. You can do your registration of business services, your driver's license, whatever. You don't have to go queue anymore. So it seems as though this is where everybody is going, that even the things that you would need to touch to access, that you can actually now do it virtually, you can do it digitally. Is this now falling in with trends while meeting an obvious need?
I mean, I would definitely say so, both in regards to, the development we have in regards to digitalizing healthcare and making it more accessible. But I also just want to touch on something that I don't think we've discussed that much, and that is, apart from, the affordability and accessibility problem, there's a very real, you can call it problem, quote unquote, of people becoming older and older. And the thing that is happening is we are getting a lot of diseases within primary care. For example, in Kenya, there are diabetes, hypertension, all of these what we call non-communicable diseases that we need to take care of. That, to be frank, we don't really have a system to do so. And that's really where this kind of application comes into place. It serves as that primary care center for you online.
And then just to add, it's walking the journey with the patient.
Did you notice that when these two gentlemen talked about age, they both looked at me?
Why are you so touchy about age, man? I mean,
all I'm doing.
everybody's aging, all right? That's the whole message that Dr. Joseph was talking about.
But he's aging beautifully.
Everybody's aging.
I mean, that's
Coming back to the issue of regulation, guys. I'm big on this one of regulation, just to make sure that everything, because it's a very good idea, it's a very good direction for us to take. We've seen, for example, what has happened with digital mobile lenders. They got into the market, they rolled on, and then now we had to bring in the CBK by changing the CBK Act to introduce regulations. So at this particular stage, from your understanding of the medical field in the country, and then from your understanding of the digital medical field, are there certain things that need to be introduced in law, in regulations, that would then support this direction that we're taking?
Yes, and I think this is why we're working so closely, and this is why actually we needed the license from the council to begin with, because it's now having these conversations with these kinds of stakeholders, then you can actually now start looking at, okay, where are the gaps? How can we fill them? And being a player in the market and working together with the regulatory bodies allows us to fill in those gaps. Just to give you an example, by working with the GDPR standards, it has obviously shed light of the things that we need to do in this country as far as telemedicine and telehealth services are concerned, and working from that framework. There's a lot that we can do to actually make it, safer, and ensure that the quality of care and actually how we store that information as well is catered for. So it's a constant and it's a continuous process that we are actually taking up together with the licensing and regulatory bodies as well.
So are there things that need to be introduced into that sphere, specifically by the Medical Practitioners Council?
I think they've started with the right step, which is first and foremost to ensure that all the medical providers are first licensed. To be honest, and this was actually highlighted in one of the info series, where there are some centers and hospitals that were actually not licensed but still providing care. So that's a first step that we need to take first, which is ensure everyone that is providing the care is actually licensed. And then the next step is the quality control. And how is that enforced? We're actually doing that. So from our perspective, together with the council, if we could have a conversation and structure how this telehealth solutions can be regulated from our standpoint, and even try and inform certain policies and have that kind of conversations, we're more than open to do so as well.
All right. Asanteni sana Daktari for joining us. Dr. Joseph Murad is the CEO of BYON8, BYON8. It's an app. Go find it on Play Store and App Store. It's on both, right?
Yes.
And then Dr. Mandela Kibiriti is a diagnostics and performance manager in the same organization. We'll be talking about developing affordable healthcare through digital solutions.